Thank you, Les. As Les said, I'm Kelli Barton from the UMKC Institute for Human Development. I wear, I guess, a lot of hats at UMKC. I'm a self-professed number cruncher, as one of my colleagues in the room said earlier. Also, door lady at conferences. I met a lot of you that way today. But today I'll be talking about some of the number crunching that we've been doing here at IHD. So if I can get the next slide. So I don't think I really need to go much into the background here. Some of this has already been mentioned today of why we did what we did. We know that we went from really a crisis-driven system where a lot of individuals who really needed services and their families are sitting on wait lists for needed services to a system where we have Partnership for Hope, where families are able to now get the services that they need for their loved ones. And so really one of the questions that we had among many was, does receiving these supports impact the families? And so what I'll be talking about today is really the kind of financial well-being and employment of families. And then in addition, we've talked about today that one of the goals of Partnership for Hope is to improve access, expand eligibility, and maximize funding for supports and services for people with IDD. And as many of the other speakers have mentioned, this is unlike other home and community-based services waivers in that counties can leverage funds for services. And so I'll give a kind of concrete example of that later to really drive that home. And so from that then, we also wanted to know really what is this broader statewide economic impact of Partnership for Hope. So we're hearing a lot today about families and the importance of those impacts, but we want to also look at what is the broader impact on the state. So in terms of impact on families, we did a survey, which George and I will talk a little bit more about later, but one of the questions that we asked was how strongly do families agree or disagree with the statement, our family's financial status has improved since he or she began participating in Partnership for Hope. And as we see, only really about 30% of family members agreed or strongly disagreed with this statement. And we were a little, I guess, surprised by that. When we first started doing this evaluation, we really thought that receiving these services was really going to have this huge financial impact on families, and we didn't really see that. And we'll talk a little bit later about why that is. Next slide. So one of the other questions we asked families was also, had there been any kind of change in their employment status or their family members' employment status as a result of Partnership for Hope? And again, we were surprised by the results. We really only saw that about 9% of the families that responded to our survey said yes. And the majority of those were either that someone in the family had either increased the hours that they worked, or they had started a job that they previously had not had. And we were really surprised by this, but when we went and did our interviews and focus groups around the state and really started talking to families and started talking to people, it became pretty clear to us that it was less about getting a job or increasing hours, but it was really about stability. And I really like this quote from a mom who said, "My work status would have changed, but because of the waiver, our son was able to transition from school to a day program with no interruption of services. Otherwise, I would have had to take a leave of absence or quit my job." And so really, it was crucial for us to not only number crunch and do the survey, but really to start talking to people and really figure out what's going on here and why are we seeing the results that we saw. So as I had mentioned earlier, the goal of Partnership for Hope is to improve access, expand eligibility, and maximize funding for supports and services for people with IDD. And one of the ways that Partnership for Hope achieves this goal is that, like I said earlier, unlike other waivers, counties may vote to participate by leveraging their tax dollars for services. So this means that counties can contribute to the funding for Partnership for Hope, where the counties and the state split that Medicaid match amount. So if you look at that second column there that says expenditures, that's the money that's been spent over the past 5 years on Partnership for Hope, roughly. So you see that the state and the county roughly pay about the same amount, about a 20% of the total amount, whereas the federal system then kicks in the remaining a little over 60%. And if you think about that, it's a little difficult sometimes to really wrap your head around millions of dollars, at least it is for me, because I don't have millions of dollars lying around. So I put that last column in there, just kind of a very simple way to think about it. So in this instance, say the state says we have $1 to put into services, $1, Bob. And the county then will match that 1 for 1. And then the federal system will then kick in 60% of the total. So for a $1 investment by the state and by the counties, their residents, the Missouri residents, are getting $5.34 worth of services. So if you think about that in terms of grocery shopping, wouldn't we all love to go to the grocery store, pay $1 per every $5.34 worth of groceries that we get? And I put that last point down there just to show, so traditionally, like I said, counties do not contribute to Medicaid services. And so if we look at it in terms of traditional Medicaid-funded services, the state would put in their dollar, so they have $1 for services, and this county line goes away. Counties do not contribute. So if that $1 is now 40%, then the federal contribution would then add up, and for every dollar that the state contributes, the residents would only get $2.67 worth of services. So still a nice deal, but we can see that the unique funding structure of Partnership for Hope really maximizes the amount of funding that we have for services. And it's really an innovative and mutually beneficial partnership. So we see that the state is getting to pay half of the match. And for counties, they're getting to take their community's tax dollars and really get the biggest bang for their buck and really serve more people. So next slide. So another thing that we did was we used existing economic data to really show how Partnership for Hope has not only impacted the individuals and their families that receive services, but the entire state. And so, you know, since Partnership for Hope has been going now for over 5 years, we took 5 years of actual economic data and started looking at what was happening and how did this money really flow through the system to impact the entire state. And this is really based on the idea that if you change the amount of money being input into a system, so for example, the increase in Medicaid spending, it produces what's called a multiplier effect, which is this direct impact kind of ripples through the economy and produces indirect and what's called induced effects. And so if you don't know what that means, that's okay. I'll go over it next. I bet you guys didn't think that you'd be learning economics before lunch, but so just ignore the dollar amounts for a second and focus where the red arrows are. And so we look at what we just talked about, the direct effects. So those Medicaid payments that are going towards services. So, you know, I go to physical therapy and Medicaid makes the payment on my behalf to the healthcare provider who provided my physical therapy. Now that physical therapy office has money that they need to go and pay, number one, pay their rent or pay, you know, wherever their facility fees, and they're also going to pay, going to pay their employees. So if you think about an infusion of cash into money, or an infusion of money into a system, that's creating jobs. We see that jobs are created here, but it's also trickling through the system. So these induced effects and indirect and induced effects are then going from the healthcare providers to the employees. And now with increased jobs and sometimes higher pay, these employees are now going out into their local communities and spending that money. So on goods and services, they're also paying taxes. And if you think about it, when you're creating jobs, these are jobs that, theoretically didn't exist before. So these are people who weren't spending money maybe in the economy. If you're worried about your job or you don't have a job, you're likely saving your money and you're not going out to a restaurant, going out to eat, you're not buying a car, and then you're not paying taxes on those things because you're not purchasing them. So with this infusion of cash, then comes this trickle-down impact on the rest of the economy. So we'll go to the next slide and we'll talk a little bit about the numbers. So when we did the analysis of the looked at the economic impact, we see, as we saw earlier, the county and state each invested about $9.1 million. So that was, about their 20% each. And then we see that this large injection of new money that comes in, that's the federal match dollars. So we see a huge injection of money coming into the system, which is then creating jobs. Employees are getting paid more, either creating more jobs to pay employees or also paying employees more, and they're spending money in the system. So when we look at all that, we see that this 9.1 then leveraged this $30.5 million in federal funds, and overall this contributed almost $60 million to Missouri's economy, which the $37.5 million is completely new to the state's economy. So we could say that, the state and the local counties could have taken this money and spent it on other things, right? They could have put it into infrastructure, built roads, things like that. But because of the way this is structured, we're getting this huge infusion of cash into the state's economy. And when this $30.5 million then trickles through the system, stimulates the economy, it comes out that it's $37.5 million new dollars to the economy and created almost 600 jobs. So I threw this slide in there just quickly. I won't go over it completely, but I just wanted to really drive home the point that, yes, we're putting money into these industries in the economy, so home health care services, things like that. We can see the Partnership for Hope services over here that are kind of in these industries. And here's where we're seeing the jobs impacts. But what the cool thing is through this program that I used, you can also see the other industries that are impacted. So these are, just the top few industries. There's a list of hundreds and hundreds of industries that were impacted. But you see all the way down here at the bottom that restaurants were impacted by Partnership for Hope. And so, like I said earlier, jobs are created and people are making more money, and so now they're going out and spending that money in the economy, right? So creating more jobs for people who work in the restaurant industry. We also see the real estate industry had a slight jobs impact too. So again, illustrating those indirect and induced effects, that multiplier effect of that money trickling through the system and creating jobs. So, all that to say, really, that the unique structure that partnership has allows the state and counties to then split that Medicaid match dollars and really provides the state more money, more funding to provide the services to those in their counties and in the state. And the second point, then we just saw Partnership for Hope draws new dollars into the state, which then creates jobs and fosters growth in the local economy.